Hello, welcome. Today we're going to be talking about inhalant abuse, and my name is Tracy Springer. I'm a licensed professional counselor as well as a clinical substance abuse counselor. Through our presentation today, the objectives learned will be how a provider will diagnose an inhalant use disorder, what are inhalants, the types of inhalants, how are they used, the street and slang terms of names of the inhalant used and methods of use, the scope of use in the USA, how do inhalants produce their effects, the difficulty in diagnostic testing of use, how inhalant use is recognized, short and long-term effects of use, the neurological disease of use, treatment, prevention, and further concerns. According to the Diagnostic and Statistics Manual of Mental Health, or what we term the DSM-5, they define inhalant use disorder as a problematic pattern of inhaling hydrocarbon-based fumes for the purpose of altering that individual's mental state, which leads to clinically significant impairment. There are 10 criteria for a provider to go through with the individual, and they're looking for the last 12 months of use. Two of these symptoms must be noted. Therefore, 2 to 3 would be considered mild use, 4 to 5 moderate, and 6 and above severe. So what are inhalants? Well, for one, the definition and to categorize them are difficult. They encompass a very broad range of chemicals which cause numerous pharmaceutical effects, and they're found in hundreds of products. But basically, they're volatile substances that produce chemical vapors that can be inhaled, which induce psychoactive, mind-altering effects. Inhalants primarily act directly on the central nervous system. However, nitrates also act on the CNS, but they tend to dilate the blood vessels and relax smooth muscles. And they're very popular for sexual enhancement. There are typically four main types of inhalants. Again, there are hundreds of them, but typically they're put into the category of liquids or volatile solvents, which tend to vaporize in room temperatures, and they're paint thinners, removers, degreasers, gasoline, lighter fluids, nail polish remover, felt tip markers. Another is aerosols, sprays that contain propellants and solvents, and that can be spray paint, spray deodorant, hairspray, vegetable oil, fabric protectors. The other two are gases, and medically used nitrous oxide or laughing gas, chloroform, um, whipped cream dispensers, propellant canisters, also referred as whippets, butane lighters, propane tanks, refrigerators. And then we lastly talk about nitrates, and they're known as poppers, snappers. There are all these nitrates that again are typically used to enhance sexually, and they can be obtained on the black market. And there's a picture above showing them all. The nitrates also are in leather cleaner, room aroma, deodorizers, and they kind of cross over to nail polish removers and diesel additives. So how are inhalants used? You can breathe them through the nose or mouth in a variety of ways. The individual might sniff or snort the fumes from a container or dispenser. They can spray the aerosols directly into their nose or mouth. They could place a chemical-soaked rag over the nose or mouth. Inhalants could be sprayed into a balloon, plastic, or paper bag, which they refer as bagging. Some inhalants are poured even on the sleeve of their coat or hoodie, and the high can last for a couple of hours, and can be longer with prolonged use. Street names or slang terms: nitrous oxide, laughing gas, whippets, hippie crack, buzz bomb, poppers, boppers, Amy's, pearls, quicksilver rush, snappers, thrust, locker room, aroma of men, bolt, climax, hardwire. And using terms would be bagging, glading, huffing, snorting. One that uses inhalants would be termed as an airhead, a bagger, or a huffer. A cracker is a tool to use opening a canister of nitrous oxide. So what is the scope of inhalant use in the U.S.? And according to the National Survey on Drug Use and Health, as well as the monitoring for future surveys, 2020, they surveyed that kids 12 and above, that not quite 1%, or 2.4 million people reported using in that year. And so then how many people have an inhalant use disorder? And again, kids over 12 in 2020 reported that they had a use disorder, where 215,000 kids, had this. Well, then you wonder how many young students do use. And according to the 2021 surveys, an estimated of 4.8% of 8th graders, 2% of 10th graders, 1.8% of 12th graders reported to using. And use isn't just for teens to use. Use also adults use as well. And we'll talk about that in a little bit. So how do inhalants produce their effects? Well, again, they're volatile substances which produce vapors. They're inhaled and absorbed by the pulmonary mucosa, which produce a mind-altering buzz or a high, right? So inhalants, again, depress the central nervous system, and they cause aesthetic effects, intoxicating, pleasurable. In contrast, nitrates do dilate and relax the blood vessels. So it's a little bit different with the nitrates. I had mentioned before how difficult it can be in diagnostic testing. Most folks think, well, a UA test will indicate use, but truly it isn't. There's only several that will show. Maybe some nitrates will show up, but EKGs or a comprehensive metabolic panel, rapid blood glucose, or arterial blood gas analysis, and often those kind of tests aren't even available to indicate a positive diagnostic test. So how can inhalants be recognized? Well, their pharmacological effects will, first of all, produce a rapid high. It oftentimes resembles alcohol intoxication. There's initial excitement, there's drowsiness, lack of restraint, impulsivity, lightheadedness, confusion, agitation, loss of sensation, which can even lead to being unconscious. And And the signs folks can look for when somebody is abusing, well, their chemical odors on their breath or clothing. Maybe there's paint or other stains on their face, hands, or clothes, hidden containers or spray cans, or soaked rag in their clothing. They appear drunk and disoriented, maybe are belligerent, have slurred speech. They're nauseous, they don't have an appetite, and a rash around the mouth. Had a client at one time swore up and down it was thrush, and there were many signs that this was going on, and unfortunately she lost her life to this, and she was only in her 30s. Very sad. So what are the short and long-term effects? Short-term, and this is the most significant, is called a syndrome sudden sniffing death or fatal heart failure. Also can have irregular or rapid heart rhythms, suffocation, memory impairment, slurred speech, convulsion seizures, can create double vision, choking, coma. The long term can be brain damage, loss of coordination, lack of muscle control or involuntary tics or movements, can cause pain, nerve damage, and weakness in the hands, feet, GI tract, circulation, and urination, can cause blindness, cognitive impairment, dementia, psychosis, and renal toxicity and failure. So I had taken this slide from the National Institute on Drug Abuse, and I thought it was a significant look, a cross-section or CT scan of a brain that on the left was an individual who had no history. You can see the gray matter is fully encased in the skull. The white area around is the skull. And B is a chronic methylbenzene user, and those are substances of gasoline, paints, dyes, fingernail polish, right? And you can see the brain is much smaller and holes in it. So there is evidence that this kind of use is a significant brain disorder here. How it's just impacting the brain is smaller, and it's a serious concern. Treatment. Well, some of the basic are cognitive behavioral, right? And this therapy looks at thinking errors, behaving, and offers maybe some coping strategies and resisting offers. There's motivational interventions, family counseling. Oftentimes it is a family system problem. And then there's activities and engagement programs, finding other activities to do, movie nights, dances, and so forth, helping teens engage in new social activities with others that are non-users. And there's support groups, 12-step programs. However, teens that have more of a significant problem really need to consider the highest level of care, and that would be residential treatment for a period of up to 90 days. So, can inhalant abuse be prevented? Yes, it can. You know, there's life skills training, school-based programs, and studies have shown that teaching adolescents both of these things have helped reduce inhalant use. Openly talking about this is a big thing. There are two things here listed on where you can find some help. The National Inhalant Prevention Coalition, there's numbers in Behavioral Health Treatment Service Locator through SAMHSA. You can also find providers specifically have the training for this abuse. So lastly, further concerns. Again, I mentioned before that people seem to think that just teens and kids do this, but that isn't quite the case. Inhalants, again, are found in so many household products. Often these are low cost, legally and illegally obtained, such as the nitrates. They provide a fast acting euphoria. In time leads to, the CNS depression. But so research has shown lifetime occurrence of people that do abuse are 13% of people ages 18 to 25, and almost 10% of people over 26. Um, Currently have a client, he's in his 40s, and he struggles hard not to use, and that is his drug of choice. Unfortunately, it has caused him severe psychosis and a long-lasting brain trauma and injury. And so with these folks that have the lifetime occurrence, there's also co-occurring psychiatric problems that go along with this, as I mentioned with this individual. 70% of the population also have a co-occurring mental health disorder, and saying 48% have a mood disorder, 36 an anxiety, and 45 personality disorder. These are considered serious considerations. So not only abuse, but causing psychotic tendencies that are long-term for individuals. So where can we get more information about it? You can look at the NIDA website. There's Drug Pub's research. There's also teensdrugabuse.com, the CDC, and SAMHSA.